This is Core Conversations with Natalie Baggio.
All of a sudden, I just had a really harsh and strong cough. Just a really hard cough. And then literally like a 2-beat pause where you breathe normally for a second, and then another harsh cough. And then a 2-beat pause, and then another one. And it was just, and it was getting to the point where I was losing my breath. I was like, I can't even catch a breath now because it's coming so rapidly, and it's starting to hurt. I was like, there's something wrong.
Right, you knew it wasn't normal.
It was not even. I'd never felt anything like it before, and I'm like, what is going on? I just didn't understand it, and so I, climbed out of bed and stumbled down the hall to tell Carol, I don't know what's going on, but I think we better call an ambulance because this is not right. Pretty soon, Medic One came, and they brought in the gurney, and they loaded me up there in the living room, and then took me out to the parking lot at our condo. And they did, I don't know what they were doing, because I'm still coughing and just hacking like a madman. And we were in the parking lot for probably, it seemed to me like an hour, but it was probably more like 10 minutes or something like that. And they got a lot of telemetry and everything, and doing all their checks and everything, and prepping for the roll to the hospital. From the emergency room, the arrival there, I really don't remember a whole lot other than a whole team of people streaming around and checking everything and doing asking me 8 million questions from whatever I could answer. And I remember Dr. Kuhnlein came in, cardiologist, and he apparently. He told me later, he said, I did a heart cath where they come in through the groin with the cameras or whatever. And he said, I figured we'd run that quick test, probably find, blockage here or there or whatever, drop a couple of stents in you over the next day or two and send you home. That wasn't going to work.
Yeah.
That isn't going to work. You've got, you're a candidate for bypass. Multiple bypass.
Right. Cardiac bypass.
Cardiac bypass, yep. He said, he said, there's at least 2 lines that are more than 90% blocked, and I don't know what else. And it's just like, whoa, now, I'm just like, are you kidding me? And I didn't know what to think. But
Scary time.
Yeah.
We had a patient who came into our office, an infant. That infant had a really high heart rate, which was unusual. And the thing that happened quickly is that nurse practitioner who was seeing the patient really noticed that was abnormal. And she used her skill set to identify that and get the team around the patient. And so she quickly alerted EMS and had them, kind of coming to the clinic to care for the patient, to get them to the emergency room, but also stabilize that patient. And I think it really goes to show that her training, but also the team was able to help stabilize that infant and help take care of the patient in a way that was top notch and really saved that patient's life and got them to the higher level of care. And that patient, I'm happy to say, is doing well today.
That's really great. And such a unique experience by being a leader and still practicing. Yeah. And it keeps you really connected to the mission of the work and recognizing that everyone in healthcare has an impact on saving lives of people in our community every day.
Yeah, that is true, Natalie.
I would love for you to share something with the community that you think they'd be interested to learn about with your philanthropic work.
Absolutely. I guess the first thing I would want the community to know is there is a role for everyone in supporting and developing health, healing, and wellness in our community. Whether it's volunteering, whether it's engaging in an event, or whether it's learning about something new that's going to be coming to our community and finding a way to advocate for it.
So I think it would be really great for us to share some of the exciting innovations and changes at Watervliet Hospital, and then also some of the services that maybe our community doesn't realize that they can access there. Do you want to start with some of the services that are offered?
Some of the services that are offered we are an excellent outpatient surgery facility with bones, joints, foot, ankle, hands. Our inpatient rehab facility is just excellent care for anybody that has a stroke or a disability. We are versatile. We have a walk-in clinic that's open 7 days a week. Our cardiac clinic now that's been open for about a year. And then we have all of those non-invasive testings, the nuclear med testing, the stress testing, and just making it outstanding. We have the infusion clinic that offers 7 days a week services as well. Our ER is always opened. We have all of our outpatient testing, our lab, our radiology, our CAT scan, our 3D mammo, just really up-to-date equipment that's just outstanding, that we can do any services for outpatient, because I know as me and you have talked, our goal is how do we focus on keeping patients out of the hospital, even though we're a hospital?
Right.
So how do we make sure that our patients have that services available in the community that is so easy for them to get to? And that's what being a rural healthcare hospital is, having the clinics, the outpatient testing, and just services that we can provide to our community.
But you were really, diligent, it sounds like, about the after surgery care once you were home, because
Absolutely.
ensuring you don't have any risk for infection is really important.
Absolutely.
And it sounds like that part was seamless for you.
It really was, and you had a great team, who talked about, they're great advocates for getting you through every phase of this, getting you ready for, the surgery, getting you ready for re-entering normal life beyond that and so forth, and just, cautions and everything else. But it was excellent. It was a great adventure.
Well, our healthcare in our community is based on the needs of our community's health. And what we can do together is create an envision, and that envision leads to an impact. I don't believe that healthcare is created in a silo. It's really how we work together as a community to deliver that transformational care.